Now in this video we're going to look at the effects of a right lower lobectomy on your interpretation of the lungs on a post-operative CT scan. To best appreciate this, you're best looking at the sagittal images. So here's a sagittal lung, and this is the lobe that's going to be resected, and in a normal individual you get a oblique fissure and a horizontal fissure. Now if this lobe is to be resected, the space that's resected is going to be occupied by the middle lobe as well as the right upper lobe. Okay, so what would happen is that this fissure would no longer exist in its expected orientation and would shift and fuse with this part here. The horizontal fissure would remain. Okay, so we're going to look at the post-operative CT scan of this patient, and as you can see, there's a single line in such a direction, and to appreciate this better I'm just going to map it, and you can see that there's a suggestion of a single fissure in this area, and there we go, and that's due to the oblique fissure descending and the right upper lobe occupying this part of the lung, and the middle lobe rotating and occupying this part of the lung. This rotation of vascular structures can also be seen on most MIP images. As you can see, this sort of swirled appearance of the middle lobe downwards, and often in these cases the surgical sutures are seen more inferiorly in the thorax. In an axial image it's difficult to appreciate this phenomenon, and it can often confuse you, but and in most cases you would just see a single distorted, slightly posteriorly appearing fissure. So that would be your basic interpretation on determining the expected post-surgical re-expansion of lobes. And there are other features such as orientation of pulmonary veins, which will be referenced on the links below.